I'm Taylor, I'm a student nurse, and I'm going to be doing a chest tube dressing change. So I'm going to wash my hands, and I've gathered all my supplies in the room, so I'm going to explain the procedure to the patient. So you'll be getting a chest tube dressing change. I'm going to change it with sterile technique, and the patient is okay with that. So I can go forward with the dressing change. I'm going to make sure the patient is in semi-Fowler's position and their arm is up just to avoid touching the tube. I've washed my hands, and in a regular scenario, I would raise the bed and the bedside table up to waist height to promote sterility. So I'm going to wash my hands and I'm going to open my kit. I'm just going to put the garbage on your bed here. I'm just going to arrange my tray how I like it so that I can use everything properly. I'm going to open my IV drain sponge package by leaning it back. I want my Gelinette. Making sure it doesn't touch the 1-inch border. Okay, and I have my sterile new container of normal saline. So I'm going to pour that into my tray without splashing anywhere. Okay, now I can wash my hands and put on clean gloves. And I'm ready to take off the old dressing. So I'm going to stabilize the tube while I take off the old dressing. Making sure I don't pull on the tube so that it cannot come out. Okay, so I will assess the dressing for any drainage, and this will go in the garbage along with my gloves. And I'm going to wash my hands. Now I'm going to take the forceps, and remove the Gelinette. So I'm going to wash my hands again. At this point I can assess the site. So there's no noted erythema, the tube has not migrated, there's no skin breakdown or anything, and there's no irritation at the site, there's no significant odor, and there was no drainage on the old dressing. So I've washed my hands. Now I can put my sterile gloves on because I'm going to use sterile technique, and wash my hands again because I touched that stuff, and then I can clean the site. Again, this would all be waist height. I'm gonna wash my hands. Okay, so now I can clean the site. And I'll make sure that my forceps do not touch the dirty tube at this point. So I started cleaning closest to the tube first, clean to dirty. Now I will go a little further from the tube. Again, making sure my forceps do not touch the tube at all. And I'm gonna grab a 4x4 now because I can cover more area. And I will clean. Okay, now I'm going to clean the top and the bottom of the tube. Making sure my forceps do not touch the skin. Okay, now that I have cleaned my site, I can dry. So I'll dry around the tube first. And the rest of the skin around the tube. As well as the top and the bottom of the tube. All right, so now I have cleaned and dried the skin and the tube. I'm going to grab my Gelinette and peel off the package so that I can create a seal with it. Okay, so I'm just going to twist it up. And put it around the tube. I will try not to touch the skin and the tube, but if I do, it's okay because I cleaned it. So I'll create that nice seal. Okay, that looks good. Now I can put my drain sponges on, and they're gonna go in different ways. So I'll start with this one going this way. And this one going this way. I'll just tuck it under there. Okay, and a 4x4 is gonna go on top of that. Now what I can do, these can be considered clean gloves. I'm going to grab my Me-Fix. This will just go in the garbage. I'm gonna grab my Me-Fix, which I've already cut, and I'm gonna create an occlusive seal on that dressing. So. And we want the entire dressing to be under the Me-Fix. So I'll make sure it's all pressed down. Okay, so that part of the dressing is under the Me-Fix. Now this piece I have date, time, and initials, so the next nurse knows when it was changed. And I will overlap it a little bit with the other piece. Now for the rest of this, I am going to tint the tube so that it has a bit of reinforcement in case the tube gets pulled on at all. So I'm just going to tint the tube like so. And the rest of the dressing is going to be occlusive and right down to the skin. Okay, so that's all sealed off. I'm going to take off my gloves and wash my hands. I'm going to make sure the patient is in the lowest position and their call bell is within reach. I'm going to clean up my supplies. I'm going to do an exit safety check and make sure the patient is all right, and then I'm going to do documentation. So how well the patient tolerated it. If there was exudate on the old dressing, I will document the peri-wound skin that I cleansed with normal saline using sterile technique and dried. And I applied Gelinette around the tube for a seal, 2 drain sponges, 4x4, and Me-Fix. and the time it was done, and the patient is safe. So that is it.